Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And Jean will not be with us today. Collectively, we're the hosts of PodcastDX. On today's show, we're going to be discussing incontinence, both bowel and bladder issues, and how they affect people's lives.
That's right, Lita, bowel and bladder. So incontinence is more common than many people realize. It can also affect people of all ages, though it is more prevalent amongst the older adult and those with certain medical conditions.
Exactly. There are many reasons why someone might develop incontinence. It can be caused by conditions such as neurological disorders, spinal cord injuries, multiple sclerosis, diabetes, childbirth, and old age and the muscles wearing out.
Right. Actually, Lita, that's very important. Other contributing factors include obesity, prostate issue in men, pelvic floor dysfunction, and also even side effects from medications. And sometimes incontinence is temporary, and it could be caused by things like a urinary tract infection or constipation.
And let's not forget that lifestyle factors such as high caffeine or alcohol intake can also exacerbate bladder problems. So incontinence can vary widely depending on the underlying cause. Some people experience only occasional leakage, while others have a complete loss of bladder or bowel control.
Right. That's exactly right. In terms of severity, we can categorize incontinence into different levels. For instance, stress incontinence. That happens when there's physical activity like sneezing or laughing or exercising. That can cause leakage. Then there's urge incontinence, where a person feels a sudden and intense need to go to the bathroom and may not make it there in time. This is common in conditions like overactive bladder or neurological diseases.
Another type is overflow incontinence, which occurs when the bladder doesn't empty completely, leading to frequent or unexpected leaks. This is common in men with prostate problems or people with nerve damage.
And for some, there's functional incontinence, which means they can't physically get to the bathroom in time due to mobility issues or cognitive impairments, like those seen in people with dementia.
Correct. And bowel incontinence can also range from occasional linkage to complete loss of control. Causes include nerve damage, irritable bowel syndrome, Crohn's disease, or injuries from childbirth. But let's talk about ways to manage or alleviate incontinence. One of the most common recommendations is pelvic floor exercises, also known as Kegels, which help strengthen the muscles that control urination and defecation.
That's exactly right, Lita. And bladder training can also be effective, and that involves scheduled bathroom trips and gradually increasing the time needed between voiding to actually improve your control.
Yeah. Dietary changes can also make a big difference. Avoiding bladder irritants like caffeine, alcohol, and spicy foods can help. And for bowel incontinence, increasing fiber intake can regulate stool consistency.
Right. Also, medications are another option. Some drugs, they help relax the bladder to help prevent spasms, while there's others out there that can thicken stool to prevent leakage. And in more severe cases, there are medical devices or surgical procedures that may be necessary. These are implants that stimulate nerves to improve control, and procedures like a sling surgery that can provide bladder support.
Right. And for people with significant loss of control, external devices like catheters, absorbent products, and even colostomy bags can help them maintain dignity and independence.
That's an important point. Incontinence can have a huge impact on a person's emotional well-being as well. Many people might feel embarrassed or even isolated, but there are support groups out there and healthcare professionals that can also help.
Yes, absolutely. And if you or a loved one is dealing with incontinence, don't hesitate to seek medical advice. Treatments are available, and no one should feel ashamed for seeking help.
This actually has been a very, very insightful discussion today, Lita. I'm glad we talked about it. Managing your incontinence is possible, and with the right approach, people can also improve their quality of life.
Well, we're going to have a special guest coming on the show in a week or two, and she is a pelvic floor specialist, a physical therapist that assists people that have pelvic floor weakness so that they can hopefully maintain their body fluids without worrying whether or not there might be a leakage.
Excellent, Lita. That's great to hear. Well, that wraps up our episode for today. If you would like to be a guest on our show, please drop us a line at info@PodcastDX.com. And if you have a moment to spare, please give us a review wherever you get your podcast.
As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.
And this is my first time to say, till next week.
Thank you.